What environmental factors affect complex genetic disorders? Have you ever wondered how the world around us influences our health? When it comes to complex genetic disorders, the environment plays a big role alongside our genes. Let's break down how various environmental factors can impact these conditions. First, consider prenatal and early life exposures. What happens during pregnancy can shape a child's future health. Factors like poor maternal nutrition, smoking, or infections during pregnancy can increase the risk of disorders. Obstetrical complications, such as premature birth or diabetes during pregnancy, can also make children more vulnerable to health issues later on. Next, think about chemical and physical exposures. Everyday pollutants, pesticides, and industrial chemicals can damage our genes or affect how they work. For example, studies show that exposure to pesticides may be linked to neuropsychiatric disorders. Air pollution has also been associated with a higher risk of autism in children who may already have a genetic predisposition. Lifestyle and behavioral factors are another important area. Choices like smoking, drinking alcohol, and diet can significantly influence the development of complex disorders such as heart disease and diabetes. These lifestyle factors can interact with our genetic makeup, changing the likelihood of developing certain conditions. Psychosocial stress and the social environment also matter. Stressful life events, economic status, and whether someone grew up in a city or a rural area can affect mental health. For instance, urban living has been linked to higher rates of schizophrenia and bipolar disorder. Gene-environment interactions are fascinating as well. Some disorders occur when specific genetic variations meet certain environmental exposures. For example, a genetic variant related to brain development might increase the risk of autism only if a child is exposed to high levels of air pollution. Similarly, certain genetic differences can make individuals more susceptible to Parkinson's disease when exposed to pesticides. Timing and duration of exposure are key factors too. The impact of environmental influences often depends on when and how long someone is exposed. Early developmental stages, especially during pregnancy, are particularly sensitive periods where environmental factors can have lasting effects on health. For families interested in hereditary health, understanding these environmental factors is essential. A family history of complex disorders may indicate a genetic predisposition that can be influenced by the environment. Genetic testing can help identify risks, but it may not pinpoint a single gene responsible for complex disorders. Taking proactive steps to reduce harmful exposures is important. This includes avoiding smoking during pregnancy, minimizing contact with pollutants, and promoting healthy lifestyle choices. Considering both environmental history and genetic information can provide a clearer picture of health risks in families. By understanding the interplay between environmental factors and genetics, families can take informed steps towards better health. It highlights the importance of managing environmental influences and making healthy choices to support overall well-being.